ADHD medications are being overprescribed to children, and healthier alternatives need to be examined. ADHD stands for Attention Deficit Hyperactivity Disorder. It is a condition of the brain that makes it difficult for children to control their behavior. First, we need to examine the possible symptoms of ADHD, the concerns of the medications, and what else we can do instead of prescribing medications. There are 3 different groups of symptoms. The first group is inattention symptoms. These symptoms can include, but are not limited to, not listening, having a hard time paying attention, being disorganized, and forgetting things. The next group is the hyperactivity symptoms. With these symptoms, children cannot stay seated, they talk too much, they're in constant motion, and they cannot play quietly. The last group is the impulsivity symptoms. With these symptoms, children cannot wait for things, they frequently act and speak without thinking, they have trouble taking turns, and they frequently interrupt others. Ritalin, Adderall, Concerta, and Methadate, and others are medications commonly used to treat ADHD and may cause health risk for children. These medications can increase heart rate and blood pressure, which can lead to an increase in the risk of cardiovascular outcomes. Stimulants can cause personality changes and can trigger symptoms of hostility, aggression, anxiety, and depression. ADHD stimulant medications have been found to cause sudden death in children and adults with heart conditions. People with a personal or family history of suicide, depression, or bipolar disorder are at high risk for psychiatric problems if taking ADHD medications. There is also the constant concern about abusing medications. If your child is taking them, make sure they are not sharing or selling them. Some researchers are concerned that these medications might interfere in normal brain development in children and teens. How many children are being prescribed medications for ADHD? A Health Affairs article dated in 2007 demonstrated that the use of ADHD medications increased from 1993 to 2003 3 times. A study conducted indicated that 56% of children without ADHD who were prescribed ADHD medications were prescribed the medication in the very first visit. Dr. Elizabeth Roberts, child psychiatrist in Murrieta, California, estimates that only about 10 to 20% of children who receive the diagnosis of ADHD actually need the medication. There are healthier alternatives to helping children's behavior. The main concept is maintaining a healthy and balanced diet for your children. Give your child plenty of high-quality omega-3 fats like krill oil. B vitamins can help with stress and remaining calm. Also reduce or eliminate grains and sugars from your child's diet. Try eliminating them for the first 1 to 2 weeks to take a notice to the improvement in your child's behavior. Avoid giving your child processed foods, and lastly, replace soft drinks, fruit juices, and pasteurized milk with purified water. Even if you choose as a parent that medication is the best choice, medication alone is not enough. Please keep in mind children and teens need exercise, a healthy diet, plenty of sleep. You can always try therapy to help deal with emotions or any situations they may be going through. And all of these tools will help to develop a positive attitude. These healthier alternatives can make a substantial change in your child's mood and behavior. Prescribing drugs is not the only answer to fixing your child's behavior. Also, doctors are quickly to prescribe stimulants without conducting a full evaluation. What if a child didn't really have ADHD or had another disorder that had similar symptoms? By focusing on the child's diet and promoting healthier ways to deal with their emotions, whether it's by means of counseling or talking to a friend or a family member, we can help eliminate health risk and developmental risk for our children. Thank you.